Thank you, Josh, and hello, everyone. My name is Alejandra Ruales. I am a senior manager at the Financial Health Network and lead our Financial Health Leaders program, working with member organizations that are measuring financial health. Today, I am joined by two fantastic guests. I have Nick Watkins, who's the head of insight and evaluation at the Money and Pension Services in the UK, and Ahmed Dermish, lead specialist in policy and government advocacy at the United Nations Capital Development Fund. Nick and Ahmed, thank you so much for joining us today.
Thanks.
Yeah.
To get us started, I'd love for you to share how are you using measurement in executing your strategies?
Yeah, great question. Well, UNCDF works across 48 of the world's lowest income countries, and we have a long history starting in the microfinance context, moving into financial inclusion, into sort of digital financial inclusion, and more recently financial health. So this is something that we've always been sort of focused on, is like, how do we ensure that we know where we're going and measuring the outcomes that we expect to see globally, and every market is a little bit different. And I think perhaps a metaphor we could use is measurement is kind of like it's your compass, right? And it's providing the direction that you've identified you need to go. Financial health measurement, in a sense, anchors your strategy and evidence. I'm looking around me. I know what I expect to see. Going with that metaphor, it's like, should we be on the mountaintop at this point? Or shouldn't we be on the mountaintop at this point? Why are we in the valley? And I think it's really powerful when you're trying to bring a lot of people together to solve a complex problem. At UNCDF, we try and look at our work from a market development perspective and take an ecosystem-wide approach, working with public and private sectors. And so defining outcomes and measuring progress is fundamental to getting those stakeholders together around a compelling vision. And you need to know what works and what doesn't, especially over time. Financial health is not something that we think will get solved tomorrow. It's something that's an ongoing issue. And so without measurement, it's hard to align people's incentives. It's hard to know whether you're doing the right thing. It's so fundamentally critical to get everyone to work together and to proceed in the same direction.
Absolutely. I think something that we've talked a lot about before is you can't actually fix or you can improve what you don't measure, right? And clearly UNCDF is working with multiple organizations. You're working on cross-sector collaborations, anything from policy, from regulation. You have your fintechs, you have your more traditional financial services companies. And I think this brings me to the question on what key stakeholders need to be engaged for a successful national financial health strategy, and how organizations align measurement metrics when working with the public and private sectors. I mean, as you know, there's different ways that a lot of these organizations are measuring outcomes. So when we're thinking about a national financial health strategy for financial health, what does that look like? And what are some of these key stakeholders that should be on the table measuring financial health?
Yeah, it's from our view, the value of being a UN agency, in most cases, we can retain some degree of neutrality, which, practically means we end up kind of brokering dialogue between stakeholders. Mm-hmm. So in this case, traditionally, we would be between the government and the private sector. Right. And so, starting there, I think the first thing we realize is that their incentives are different. Yeah. And so, with a quality measurement framework, you can actually align the objective despite disparate incentives. So you may be looking for an improved bottom line. You may be looking for more customer loyalty. That might be your driving, incentive for financial health. You might be looking for more productive people. You might be looking for tax revenue. There's other public policy reasons for promoting financial health. Defining financial health as people have a way to save, they can plan, they can invest. Those metrics are, almost neutral to your particular incentives. So I think that's kind of how we tend to look at it, is not worry so much about aligning incentives perfectly, but having complementary ones, right? And I think a good measurement framework for financial health does that. The one element that is really a place where we need to improve, and we'd love to do more work in this space on that stakeholder side, is bringing customers into that dialogue, right? Mm-hmm. So we have the private sector, we have the public sector, and there's this other corner of this triangle is how do particularly public policymakers understand that human experience around financial services and how it meets their needs? And in a lot of markets where we work, it's just not as organized as we would like it to be, or it's not directed towards this issue as an advocacy outcome. And so I think there's a real significant opportunity there to align those interests in that way. The public sector to listen to customers more, private sector to participate more actively. And I know, I mean, it's great to have Nick on this conversation, because I know the UK kind of has a long history of strong consumer groups, clear messaging. I worked there as a regulator many years ago, and I personally experienced the power of those consumer groups in that way. So I'm curious in terms of your views, in terms of lessons learned. Am I being too ambitious? 48 LDCs, we need UK-like, consumer advocacy groups around financial health.
I mean, I think you're absolutely right. I suppose one observation I would make, though, is that, different groups always have a different view of the problem, and lobby groups will obviously always come from a particular perspective, a valid one, but it's, I think one of the things that we're trying to do is to pull together all those different views. So one of the things that we did, for example, in terms of developing the UK strategy, was actually to hold what we call listening events. And we pulled together, I think, 1,000 stakeholders in listening events across the UK, pulling people together from employers, business groups, delivery partners, educators, frontline practitioners, lobby groups, all of them together, and say, okay, what we did was we produced a document which said, this is how we think the world looks. This is based on our evidence and other people's evidence, and this is what we think the problems are. This is what we think maybe potential solutions are. Come to these events and tell us, what do you agree with? What do you disagree with? Because I think you're right. You want to have that compass. You want to have that, where are we going? But everybody's starting from slightly different points. So I think, I would say over and above that measurement, which, since it's my day job, obviously I think is important, but over and above that is about that co-creation of what is the real problem. If we haven't got people saving or building a savings buffer, why is that? Yes, part of that is around low income or high expenditure, and certainly as MAPS, that's not something we can control. But we know there are other things that inhibit people from saving. If we can get a common idea on what the problem is, we've got more chance of working towards a solution.
Yeah. I mean, I think that's a really, really great point, Nick. And something that, we got this question, and I think this is a question for both of you, actually, which is, what are some of the indicators that show you are going in the right direction in your work? And what are the indicators of financial health, right? Because, we're talking about measuring, and how can we align these strategies, making sure that we're measuring if those strategies are in fact effective. But what are some of those indicators that show that you're going in the right direction? Ahmed, do you want to respond to that first?
Yeah, I mean, I think this is, honestly, the indicators are less of a problem for us. It's more, can you even collect them in the markets where we work, right? So, simple indicators, how much liquidity do you have accessible in your whatever account? It could be a mobile phone-based wallet or a bank account, but that's relative to your income. Right. Mm-hmm. And so having accurate data on, income disparity and income levels, knowing who you are, and whether or not the amount you have in your bank is sufficient to cover that, are often just frankly data gaps in many of the markets where we work. And what we're hoping, and I'm just going to quickly pass this question on to Nick, is, by having really clear indicators, that actually helps us design data systems where we can collect that data in the first place.
Yeah, I think so. A couple of answers, really. I mean, I think the first thing is, we're lucky. We run quite a big survey. We were able to do quite a lot of analysis on that and identify what things are correlated with financial well-being. And at one level, you could say, well, was it a huge surprise? We came out with, have you got a savings buffer? How much do you use credit? Are you planning for the future? And I think, they're very similar to some of the goals that you've got in the financial health network, some subtle differences. But I mean, some of the domains are similar. I suppose two comments I would make. One is we've, in terms of the tracking from a survey point of view, we focused more on the sort of like the habit of saving. So rather than saying, have you got £500 or $500? Have you got $1,000? Have you got $10,000? We've focused on, are you saving regularly? Because if you get macroeconomic change, if you get coronavirus, that can really throw your measurement. So what we've tried to do is to say, okay, something as terrible as coronavirus will stop some people from saving, but it's what you hope is that people will save a bit less. But can you build the savings habit? That's the sustainable thing. I think the other thing that we've done, and it will differ in different markets, of course, but is to say for each of our goals. So our goals are children getting a meaningful financial education, working age people in our struggling and squeeze segments saving regularly, people not using credit for everyday food and bills, setting advice when they need it, and people planning for and in retirement. And as I said, I don't think any of those people would go, my goodness, how did you discover that? But what we've then tried to do as the next stage is to say, okay, if this is the goal, what are the barriers to it? Therefore, what have we got to overcome? Why is it that some people don't have a savings habit? How much is it about income? How much is it about attitudes and motivations? What interventions can we find? And Ahmed, you use one of my favorite terms, what works? What interventions have helped people to work? And I think one of the other things that we do with measurement is we challenge some people's preconceptions. So one of the things, you sometimes hear is the reason people don't save is they don't have enough money. Now, in some levels, that's true, but actually you see groups that are people on low income who do save, and similar people on the same-ish income, similar household composition who do save. So to me, you're going to say, yes, very low income is undoubtedly a problem, but actually it's very hard to fix. Let's now use the evidence. Let's look at the measurement data to see why do some people save and some people don't? Why do some people use credit and people like them don't? What is it? And therefore, we can start to work towards how do we solve the problem. And, for example, one of the things we've identified, and I know it runs in the States as well, is the trials around payroll saving. As part of your, link to your pension contribution or your payroll, a savings pot. Does that work? It seems to. If it does, then we'll want to track over time how many employees either opted in or did opt out of a payroll savings, and why not? And why does it work? And so gradually you start to build, okay, this seems a good idea. How do we make it work better? So I think the measurement isn't just the problem's over there, go and fix it. It's got to be, this is a big problem. This is what we know about why it exists. This is what we know about what might work to solve the problem. And then how do we pull everybody together to work in the same direction?
Right. And I think that the other piece of that, and I know this brings me to you, Ahmed, is this idea of using measurement as a tool to identify what's going well, what's not going that well. And this idea of, UNCDF going from this financial inclusion focus to start thinking about financial health as an outcomes-based approach. Does that access to bank account is really improving the outcomes of the person that has access to that bank account or not? So can you speak a little bit about how you're using now this, financial health approach and how measurement is related in the way that you are measuring outcomes for your programs?
Yeah, it's a great question because it's really an emerging practice. Frankly, as a UN agency, the best tool we have is the SDGs. Not only are they colorful and easy to remember in many ways, there's 17 of them, so it's not easy to remember all of them, but the outcomes are really meaningful, right? People want education, they want clean water, they want better health, they want better access to transportation, they want clean cities. And frankly, I'm a financial inclusion professional most of my career, and it doesn't really correlate as well with meaningful outcomes that the SDGs embody as financial health does, right? What we're seeing now is by looking at those outcomes, if I have ability to plan, ability to be more resilient in terms of shocks, ability to invest in my ideas, just that resilience innovation nexus between, I am more financially healthy, I can withstand a shock, and I can take my idea to the next level. Those two things, innovation and resilience, underpin the entire objective of the SDGs, right? And so I think for us, really trying to promote financial health is about that resilience innovation nexus. And the outcomes we look for are really just mapped directly to the SDGs because those are meaningful. Those are what people want. They don't wake up in the morning wanting a bank account necessarily. They want to send their kids to school.
Yeah. And that makes a lot of sense. And you know, as we start closing the session, I would love for each one of you to share with our US, most primarily US based audience, one lesson learned from your measurement work based on the strategies that you're implementing. Nick, why don't you share with us first, and then Ahmed, think about your one strategy, or I'm sorry, one takeaway.
Okay, I'll avoid just saying have evidence because that's my day job, as I said. I think for me, the really important thing is to think about how you carry this broad coalition that is the only way we'll deliver improved financial well-being, financial resilience. So I think, you know, you've got to involve everybody from the beginning. We're working with a group of challenge groups to actually say, okay, if these are the goals, what do we do? We're trying to engage people early on. So my learning is you've got to co-create the solutions. Otherwise, it's just another great strategy, a great idea that will be forgotten in a year or two.
Yeah, I think from our end, I love that co-creation thing. I literally wrote it down. I think our challenge is it's a change management problem, right? And we're hoping the measurement component can orient, you know, all the stakeholders around just at least awareness of it being a change management problem. You know, and to steal a little bit from like, you know, the change management literature, it's not just a singular issue. It's systemic change, it's organizational change, and it's also individual change, whether you're designing products, making policy, or experiencing the services yourselves and feeling like this is just how it is. I'm always over indebted, you know? And so I think really trying, I mean, Nick, you did such a great job sort of articulating these different levels. And I think that's why for us, like, how can we use measurement just to facilitate that change at all of those levels?
And I think I'm sorry, have we finished, Anna?
Yeah, no, close us off.
I was only going to say, I think, you know, building on that, we need to be really clear that it's not going to be one size fits all. So we have to understand, how do we help some of the more marginalized group? How do we help the people on the average income who think they're doing okay, but aren't planning for the future? So I just think that's the other important thing for me, is to get that more holistic view, but understand there are different solutions for different types of people.
Absolutely. And unfortunately, we're out of time. I think we could spend another hour talking about this very important subject. So thank you so much, Nick and Ahmed, for sharing your work with us today. I hope that we have inspired our audience to anchor their strategies in evidence and measurement.
Great.
Thank you for joining us.
Thank you.
And for everybody else, thank you for tuning in. This concludes our measurement session, but please stay tuned for a few extra minutes. We're going to kick it back to Josh and Helen for some closing remarks. Thanks, everybody.